Here's a CT with intravenous contrast that was performed in a patient with right lower quadrant pain. And so when you think about right lower quadrant pain, the first thing you think about is appendicitis. And in this case here, here's the appendix right here. And the appendix has some gas within it, looks pretty normal in thickness. There's no real stranding surrounding the appendix here. So the appendix looks normal, but this patient actually has free intraperitoneal air. When you see this free intraperitoneal air, one of the most common places that it can occur is your stomach, either distally or proximally within your duodenum. And in this case here, we can see small little foci of gas kind of surrounding this distal portion of the stomach. So this is really concerning for this being the lead point for all of this free intraperitoneal air. Now, if we look at the coronal view on this particular patient here, we can see that sure enough, within the distal stomach here, there is actually a hole right here within this distal stomach here, and this is where the perforation is occurring. Now, why is this patient presenting with right lower quadrant pain? Well, the reason that they present with right lower quadrant pain is that the gastric contents end up spilling out and go along the right paracolic gutter here. You can see some fluid here, and then within the pelvis. And so these patients can actually present with right lower quadrant pain. So when you have right lower quadrant pain that's caused by either a perforated stomach or perforated duodenum, this is referred to as Valentino syndrome.